So you must have heard about the idea of evidence-based policymaking. So if you look at different reports in the media, people and donors and governments are saying that we are moving from uh, policies based on emotions, or policy based on raw data. We are going to get new and timely data, and then we will base our policies and our programs on those that kind of data. So that is the idea of evidence-based policymaking. At this moment, and of course, policy development is always a slow and non-linear process. So it's not that you go from facts to options, and then you select the options based on the different indicators you have already devised, and then you implement it. So that is not that is the bookish way of telling how policies are made, but actually policies are made in a torturous way. So who are the decision makers? Decision makers in health policies are politicians, donors, bureaucrats, and professionals like doctors. But people have also started the questioning the idea of evidence-based policymaking. So they are saying evidence-based policymaking suggests that there is a technical solution to these problems, which are social and political problems. So policy is not based on only facts and figures. It's based on how a society looks like, how it thinks, what its aims and objectives are. So it's not based on facts. So we need facts and figures, but with that we have to also see how our society is working. So rather than evidence-based policymaking, we should move to evidence-informed policymaking. Pakistan is a lower middle income country, and the characteristics of these countries are they are a little better than the poor countries, but many of the problems are similar, like weak regulations, weak capacity, lack of purchasing power, patronage in the political system, donor funds, relies on donor funds, research not available to the policymakers in time. So all these problems then hinder or hamper the policymaking. So there was an article which looks specifically at how health policies are made, and it is based on interviews and focus group discussions with current and previous health policymakers. So the results of that article were that the understanding of policy is not clear. So many of the policymakers argue that PC1, which is a form, Planning Commission 1 form, is the policy, which when PC1 is related to a specific project, it's not a policy. Similarly, some other people think that technical guidelines are a policy, or budget is a policy, or government action plan is a policy, which they are not. Health policy, secondly, health policy is not a priority of governments because health is not a priority. So that figures when we look at the budget of health in Pakistan. Most of the policymakers don't give much importance to data, and of course data is also limited and is of questionable quality. Agenda setting is not based on policy, but agenda setting is based on party manifestos or media. So whatever appears in the media, politicians or decision makers try to move in that direction. Political leaders are the key decision makers. Technical input is partially included in the policy. So technical input is included, but it's partially included. And professionals, of course, they also limit their knowledge dissemination if they think that it's not good for for them or for their cohort or for their institution. Donors' help is there, but we have discussed that there are problems when you are dependent on donors. The process is ad hoc policy making, and now after 18th Amendment, things are in a flux, so gradually stabilizing. And many policymakers perceive others as policymakers and not themselves as policymakers. So this also affects the making of policy.